I'm Sara McFee with Minnesota Lions Eye Bank at the University of Minnesota and a member of the Donate Life Minnesota state team. Eye, tissue, and organ donation changes and saves lives, providing hope and healing to thousands of people. Organ transplants can be performed through living and deceased donation. Eye and tissue donation is performed following death. One individual at the time of death can help restore health or save the lives of more than 75 people through transplants. Countless others across the world are helped because donors for research support the efforts of researchers seeking new treatments and cures. Nationally, 22 people die each day waiting for an organ transplant, and a new name is added to the transplant waiting list every 10 minutes. Currently, there are nearly 117,000 people in the United States on organ transplant waiting lists. More than 3,300 of those people waiting live in the three-state area of Minnesota, North and South Dakota. Minnesotans have chosen to save and transform lives by being donors. 62% of Minnesota adults have registered to be eye, tissue, and organ donors. As a board member, you need to know the following 5 things about eye, tissue, and organ donation. Every hospital must have written agreements with appropriate donation organizations. Eye and tissue banks are selected by hospitals. Service areas for organ procurement organizations, also known as OPOs, are federally designated. Among other requirements, written agreements must set criteria for when and how to make a referral for donation of individuals who died in your hospital. Agreements must also define responsibilities of your hospital and the eye banks, tissue banks, and OPOs. Agreements must establish and ensure collaboration among hospitals, eye banks, tissue banks, and the OPO for donation education and allow for consultation of hospital policies and procedures related to donation. Written agreements must also allow access by donation organizations to information about patients, including medical and death records and next of kin information, in order to facilitate the donation process. Note that HIPAA, the Health Insurance Portability and Accountability Act, permits access to patient information by donation organizations for the purpose of evaluating and determining potential to donation and facilitating the donation process for transplant and research. Agreements also allow access to the donation organizations for the retrieval, processing, preservation, storage, and distribution of recovered tissues and organs. Thirdly, all hospital-based deaths aged 20 weeks gestation and older must be referred for evaluation of the deceased to be a donor when 2 or more clinical triggers are met for brain death or within 1 hour of circulatory death. Similar to hospitals, eye banks, tissue banks, and OPOs undergo inspections and are required to maintain accreditation and specific registrations and licenses. Eye banks are inspected and accredited by the Eye Bank Association of America. Tissue banks are inspected and accredited by the American Association of Tissue Banks. OPOs are inspected and accredited by the Association of Organ Procurement Organizations. Additionally, eye and tissue banks are inspected and registered with the FDA. Some states require tissue banks to have separate licenses for tissue bank operations. OPOs are regulated by multiple government agencies. During inspections by your state Department of Health, the Centers for Medicare and Medicaid, or the organization that accredits your hospital, your staff may be asked to show policies and procedures related to eye, tissue, and organ donation. Your hospital's policies and procedures must support the need for maximum viability of the donor's organs, tissues, and eyes. Your staff will also be asked to show your agreements with eye banks, tissue banks, and organ procurement organizations, as well as their respective accreditation and documentation. Your staff will be asked to ensure that your hospital works cooperatively with eye banks, tissue banks, and the OPO to provide and document donation education, including mandatory new employee and annual education of appropriate staff, as well as education when there are changes in your hospital policies and procedures or when concerns related to donation process are identified. Your staff will be asked to demonstrate your hospital's adherence to the donation process by providing data about the number of deaths, referrals made for donation, and timely referrals to the donor referral phone line. Inspectors may also ask for rates related to who made the request for donation and how many donation referrals converted into actual donors. It is important to note that only individuals, designated requesters, specifically trained on how to talk with family members or others about donation, are permitted to provide information and ask for decisions about donation. Eye bank, tissue bank, and OPO donor coordinators are trained to inform and ask for decisions about donation. Finally, your staff may be asked to show the quality mechanisms your hospital has in place to show families of all potential donors are informed about their options for donation. As a board member, here are 5 things you should be asking about your hospital's donation program. How does our hospital promote a culture of eye, tissue, and organ donation, registering to be a donor, and how do we recognize donors and their family members? 2, does our hospital have a team or committee designated to focus on eye, tissue, and organ donation? 3, are our hospital leaders and medical staff members actively involved in ensuring hospital policies and procedures meet the laws, regulations, and standards related to donation? 4, are eye, tissue, and organ donation requirements integrated into our hospital's quality assurance performance monitoring so that our hospital supports the best possible outcome for potential donors becoming actual donors? And finally, ask, what are our hospital's referral, timely notification, appropriate requester, and conversion rates for eye, tissue, and organ donation? And how is that information shared throughout our hospital? Eye, tissue, and organ donation is an important program for your hospital to develop and maintain. While your hospital's first goal is to save lives and improve health, sometimes it is not possible. Through your hospital's donation program, you are supporting lives and transforming lives through transplants that may be done through your hospital services or by supporting the work of transplant centers elsewhere. Your hospital is supporting the work of researchers across the world. During 2016, more than 69,000 eye and cornea donors provided nearly 83,000 corneas for sight-restoring cornea transplants. Nearly 16,000 organ donors provided more than 36,000 organs, including kidneys, pancreas, liver, heart, lungs, and intestines for life-saving transplants. And about 30,000 tissue donors provided approximately 1.5 million tissues for life-saving and healing tissue transplants. Your hospital's donation program supports these gifts of life and sight by working with the donation organizations, honoring your donors and their family members, and supporting the mission of transplant centers who receive donations from your patients. In addition to saving and changing lives, donation for transplant research helps family members who grieve the loss of a loved one and are comforted in the knowledge that their loved one was able to help others. Among your employees, family, friends, and community, you may know of somebody who has given the gifts of life and sight through eye, tissue, and organ donation. You may know somebody whose life has been saved by an organ transplant or transplant transformed by a tissue or cornea transplant. the support of your hospital is critical to making a difference through donation. Thank you for the opportunity to share this important information.